conversation, like the history of why alcohol is treated the way it is, sort of not within mainstream medical treatment, also not within mainstream psychology treatment. It's like its own little stepchild, eddy of treatment, and just the way we think about it is sort of segmented away from medicine and the way we think about therapy in general, which is weird. That's a long history how things came to be. That would be a longer conversation, but it's definitely true. And I work with tons of people who have a loved one with both a substance use issue and a psychiatric issue, and they are really stuck because, any treatment program that primarily treats psychiatric problems is not really that receptive to treating substance use problems, and vice versa. Like, most substance use treatment programs are not really very good or receptive to treating psychiatric problems. So you're kind of in trouble. And my experience is that, people often have both of those things, and maybe one leads to the other. And so it really is a tragedy that we don't do a better job of addressing both things at once and using the same kind of mind and perspective of addressing both those worlds of difficulties, because I think there's a lot of overlap. The idea of positive reinforcement, for instance, like that's probably the most well-researched concept in the world of psychology, and yet we don't think about it as applicable to alcohol use problems. I'm not sure why. Like, it makes perfect sense to think like, okay, if somebody does something over and over again, they must be getting something out of that. And there must be some reasoning in their mind, some rationale, some physiological experience that is rewarding them or positively reinforcing them for doing that. And I think this is such a deep thing, but I think that it's something like in our culture that feels more comforting to think like, you're an alcoholic who always has been one, and you're susceptible, and it was just a matter of time. And that way, some people can feel like, well, it doesn't matter how I drink, I'm not one of those people, like there's somehow the idea of having an alcohol use disorder is not about what you drink, but who you are, that there's something inherent about a person that makes them either an alcoholic or not an alcoholic. And I think that's just patently false. That the idea of positive reinforcement is very, very important in substance use problems in a way that I think makes people uncomfortable. It's uncomfortable to think that like, oh wait, she's getting something out of drinking like that? That doesn't make any sense to me. Why? That feels uncomfortable. It's more comfortable, I think, culturally for us to think that there's something wrong and that it's just sort of constitutionally different about that person.
Exactly. And so I want to ask you, when someone is getting that positive reinforcement from alcohol or whatever substance they're using, would you say that that is coming from the logical side of their brain or something they're consciously choosing? Because I think that's a challenge for a lot of family members, thinking, they're choosing to drink or they're choosing to use. And so what's going on in a substance user's mind when they're faced with that challenge of to use or not to use, and then they end up breaking and going back to it? Can you talk a little bit about that?
Sure. Yeah, it's a really good point. I think it's so confounding for a family member to see that their loved one is making a choice to do something that feels so obviously risky, dangerous, foolhardy, whatever it may be, it seems so obvious from the outside that that's a bad choice. And yet when I talk to family members and I say, well, what do you think they're getting out of that? Like what makes sense to them about what they're doing? Family members always understand on some level. Well, I know that it helps her feel more connected to her friends who all drink too, or, well, his job is really stressful and, at the end of the day, he just can't turn his mind off. And I know alcohol helps with that. Or, there's a big but that comes next, which is like, but there's this whole slew of, reasons why you shouldn't do that. And why can't you think about that? But the first part, usually, like, as unappealing as it is to think about the reasons why someone might do those things, usually family members get it right away. Like, yeah, well, I do understand that. And I think that that's an important thing to say, because it's it is hard for a family member to accept that there is that side, but they do have a lot of information about what that side looks like. They do have a lot of information about, what is really motivating their loved one to keep doing something that, also has these downsides. So why would somebody return to or continue doing something that has negative consequences? Well, first of all, that's basically the definition of a substance use disorder, is that you keep doing something even though it's causing you negative consequences. And so by definition, that's what we're looking at, is we're looking at somebody who feels mixed. They do have reasons why it seems like a good idea, but they also have reasons why it's clearly a bad idea, and they're trying to balance that out. And that's what we call ambivalence. We just call, somebody who is stuck in that place of like, well, there are good reasons to do this and there are reasons why I really shouldn't do that. And that's a state of ambivalence that is very uncomfortable. And we like to resolve ambivalence. And so you fall on one side or the other. And that results in action, right? So there's a way that ambivalence can be perceived as like the enemy, oh, well, she's not really committed, or, oh, she said yesterday that she was gonna stop doing this, but there she's doing it again. Or, you know, you know, he had this whole conversation with me about how he really understood that it was terrible, but now there he is saying that, he's gonna return to it. Like that, what is that? And the thing is that, from a family member's perspective, the downsides are so much more prominent and impactful. Whereas for the person themselves, they're really living in a skin that tells them, from the part of the sort of lizard part of the brain that says like, you need this thing, it's going to make you feel better, is telling them like that they need it. And so from the person's perspective, it is like very compelling, and much more compelling than the downsides might be. It's kind of what's straight in your face at that moment. But I think that that state of ambivalence is a really normal part of any change process. And as soon as you think about it that way, you think about substance use and trying to resolve those problems as a big change that you're trying to make. As soon as you think about it that way and kind of broaden your lens back of like, oh, you mean like trying to lose weight, or trying to exercise more, or trying to treat my kids in a different way, or trying to, any big change that you might be anticipating making, everyone understands ambivalence is part of the deal. Like that's part of being human. And so I think once you sort of step back and go like, oh yeah, right, this is a big change, and big changes involve ambivalence, then I think a whole wellspring of compassion becomes available for what that's like, and how ambivalence really is a necessary part of the process.